Caitlin Mossart. I'll be doing the GI assessment for patient MM, 32-year-old male. Okay. Have you been having any appetite changes?
No.
Any weight changes at all?
No, not that I know of. I don't really weigh myself that often.
Okay. Not any change in like the way your clothes are fitting or anything like that?
No.
Okay. And any trouble swallowing?
Nope.
Any food intolerances, anything that seems to bother you?
I don't think so, no.
Do you ever have any like heartburn or the need to use any antacids?
I've had heartburn, but it's not been anything recent,
Okay.
and it's not like, I don't know, I don't notice it with certain foods or anything.
Okay. Nothing seems to be triggering it in particular?
No.
Okay. All right, and are you having any recent abdominal pain?
No.
Any nausea or vomiting?
No.
And then how about your bowel habits? How often are you having a bowel movement?
About once every other day.
All right, have you been noticing any diarrhea or constipation recently?
No.
And do you use any laxatives or stool softeners?
No.
Any past problems with like abdominal problems?
No, I've had abdominal pain like in the past to where it feels like I need to go but I can't type thing, but it's happened maybe like once in the year. Like it doesn't happen regularly by any means. So.
Okay. And have you ever had to take any medication or see
No.
somebody for anything like that? Kind of just resolves on its own?
Yeah, it just resolves.
Okay. And then have you ever had any abdominal surgeries?
No.
Okay. And then what medications are you taking?
I just take a multivitamin once daily, and that's pretty much it. I take ibuprofen and Tylenol for headaches, but.
Okay. And about how much alcohol do you consume?
Like less than 1 drink a month. I don't consume that much alcohol at all.
Okay. And when you do, about how many drinks in one sitting?
Just like 1.
Okay. And then do you smoke or have you ever?
Mm-mm.
And then how would you describe your typical diet?
I could definitely do better. I eat lots of like sweets and processed foods, and definitely don't get enough like vegetables and fruit. That's something I need to work on.
All right, as long as you're aware of that, but do you have any like plan or intention of doing anything different at this point?
Not really.
All right, that's fine. It kind of has to be a choice that you make on your own. Nobody can ever force you to do that, but of course it's encouraged that you would, do your best to try to choose the healthier options in your diet, picking things high in fiber. That's going to help with, the abdominal issues that you've been experiencing sometimes, just to have regular bowel movements, things like that. Drink plenty of water, of course, will also help that as well. Any concerns at all in relation to like abdominal pain or problems that you have, concerns at all?
No, not really.
Okay. All right, well, we're gonna go ahead and move into just like a physical exam. I'm gonna have you just go ahead and just lay there for me. Okay, I will have you bring up your shirt just right here. Okay, so I'm just gonna start by just taking a look. I'm just looking at skin tone. Everything looks normal. I'm not noticing any like asymmetrical, no like bulges or tumors, pulsations. Hair distribution is normal for a male, and not noticing any like abnormal lesions. Nothing that causes any concern when I just take a look at it. So I'm going to just go ahead and just take a listen. All right, bowel sounds active in all 4 quadrants. I'm just going to listen over some vessels here. Listen to the aorta. And the renal arteries. iliac arteries, and I could also listen to femoral, but I'm not noting any bruits or anything that causes any concern for me. Okay, well, I'm going to go ahead and just do some percussion here, just listening to sound. So just noting a general tympany, which is normal. I am actually going to have you go ahead and sit up for me again. I'm just going to take, you can kind of angle yourself that way a little bit. Perfect. And I'm just going to be checking your kidneys, seeing if there's any pain or tenderness. So just let me know. I'm just going to do some tapping here on your back. Any pain?
Mm-mm.
And any pain there?
Mm-mm.
Perfect. Okay, I'm going to have you go ahead and lay back down again. Okay, and I'm actually going to have you put your feet on here so that you're, yep, perfect like that, knees up. And then I'm just going to go ahead and start feeling. You let me know if you're having any pain. I'll start just kind of with some light palpation here. Now, are you not feeling anything?
Mm-mm.
Problems? Okay, I'm going to go a little bit deeper. And any pain with that?
No.
Okay, well, I'm going to go ahead and just try to feel for your liver here. My hand back behind you. Okay, take some deep breaths for me. Okay, another one. Okay, so just noting just the edge of the liver right there, not feeling like abnormally enlarged or anything. I'm going to go ahead and just feel around here for spleen. Okay, take some deep breaths again. Another one. Okay, and I'm not feeling spleen at all, which is normal. I mean, it's not enlarged or anything. And I will try to feel for kidneys, which is not always palpable at all, but I'll just go ahead and take some more deep breaths for me. Okay, not feeling anything there, which is fine. Okay, we'll do one more time over here. Okay, not feeling that one at all either. That's also normal. Okay, I'm actually going to lift your shirt just again here and just see if I can feel for your aorta. Okay, so I am feeling pulsation of the aorta. And nothing feels abnormal. It's a normal width. Okay. All right, well, I'm seeing everything coming back normal for all these exams that I have done. So this will conclude the abdominal assessment.